A bunion is a bony lump that forms at the base joint in the big toe. Bunions form when tight shoes, an injury or a person's inherited bone structure result in the big toe being pushed toward the other toes on the foot. Eventually, the big toe joint becomes enlarged and painful, and can lead to difficulties with exercising and walking. Bunions are a common affliction that involves inflammation, pain and misalignment, crookedness, at the base joint of the big toe. In essence, bunions are chronic joint sprains that push the big toe towards the second toe, creating crowding and disfigurement of the forefoot. Bunions often have a hereditary component and are more common with certain types, shapes of toes and feet, but wearing narrow-toed, ill-fitting and/or high-heel shoes are big risk factors. In the United States, bunions are particularly common and affect more than 1/3 of all women. Learning how to treat bunions naturally can help thwart their progression and reduce symptoms, which may negate the need for more invasive measures, such as corrective surgery. Try foot exercises. Exercises can help slow or even halt the progression of your bunion, preventing the need to eventually get surgery. 1. Try the following exercises every day, especially after removing your shoes. Stretch your big toe. Use your fingers to pull your big toe into proper alignment with the rest of your toes. Stretch the rest of your toes. Simply point them straight ahead for 10 seconds, then curl them under for 10 seconds. Repeat several times. Flex your toes. Press your toes against the floor or a wall until they are bent back. Hold them for 10 seconds, then release. Repeat several times. Grip with your toes. Practice picking up an article of clothing or a towel with your toes, dropping it, then picking it up again. Wear a bunion pad or shoe inserts to realign toes. If you catch your bunion in the early stages, a bunion pad purchased at any pharmacy or drugstore may help to alleviate pain and direct your toe back to the proper direction. Shoe inserts may also help to realign your toes when you are wearing shoes. Tape your foot and toes into a normal alignment position. Your toes may adapt to the normal position after being taped for a week or 2. Ask your doctor if you need assistance with this process. Relieve the pain. Exercising your feet and toes is well and good, but the intense pain bunions cause should also be addressed. Ease sore feet using the following methods. Soak your feet in warm water. 2. Prepare a bowl with warm water and allow your feet to soak for 20 minutes. The warmth will soothe your joints and temporarily alleviate the pain. Try an ice pack. For particularly bad flare-ups, ice packs are a good choice. Fill a plastic bag with ice and wrap it in a thin towel. Apply the ice pack in 20-minute increments several times a day. Take non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, to relieve the pain. For mild to moderate bunions, a flexible bunion splint such as Bunionade has been scientifically proven to effectively correct hallux valgus and relieve bunion pain. Consult a physician. If you're experiencing extreme pain that seems to be getting worse, or if your feet no longer fit in your shoes, consult a physician right away. It's possible to slow or halt the progression of bunions, but you can't actually cure them on your own. Take prescribed pain medication. In some cases the doctor will advise you as to lifestyle changes and prescribe a medication for the pain. To prevent the bunion from getting worse, be sure to follow the doctor's advice. Consider surgery. As a last resort, consider having surgery to remove the bunion, shave the bone of your big toe and realign your big toe with the other toes. Bunion surgery is common and considered to be the only cure for bunions. There are several options for a bunionectomy surgery. Conduct research with your doctor to find out which option is best for you. Surgery usually helps bunions, but it doesn't guarantee that you will be completely free of pain, or that your toe will look perfectly straight. Follow up the surgery with proper lifestyle changes and exercises to prevent future pain and inflammation. Go barefoot. Whether you inherited a propensity toward getting bunions from one of your parents or your bunions are the result of a lifetime of wearing shoes that are too tight, spending as much time as possible walking barefoot can prevent and even heal bunions. Walking barefoot strengthens the muscles in your feet and helps the bones realign in their natural position, rather than having to conform to the shape of your shoes. 4. However, if your bunions are advanced and very painful, walking barefoot can make them feel worse. If this is the case, only walk barefoot on thickly carpeted floors. Otherwise, wear padded socks when you're walking around the house and doing your daily activities. Wearing thick, comfortable slippers around the house is another option to help ease the pain of your bunions without subjecting your feet to the pressure of wearing shoes. See if your shoes are making your bunions worse. You may think they are comfortable and good for your feet, but even tennis shoes and other athletic shoes could be making your bunions worse. Wear supportive shoes with good padding and arches. If you're in doubt about what type of shoe to buy, ask your doctor for advice. Make sure that your shoes are the right size for you. Wearing shoes that are too small can make bunions a lot worse. When you're trying on shoes, your big toe should never touch the end of your shoe. Use the thumb rule. Make sure that there is a thumb's width of room between the tip of your big toe and the end of your shoe. Don't wear high heels or pointy toes. They're pretty, but heels and stylish pointy-toed shoes are terrible for bunions. They lead to additional pain and prevent the bunion from healing. Wear less restrictive sandals whenever possible. Avoid activities that lead to bunions. Ballet dancing, and other activities requiring constrictive shoes, may lead to bunions. If it isn't possible to do the activity in shoes that are healthier for your feet, avoid the activity altogether. Make an appointment with an osteopath or chiropractor. Osteopaths and chiropractors are joint specialists who focus on naturally establishing normal movement and function within spinal joints as well as peripheral joints, such as those in your toes. 12. The crookedness of your bunion can sometimes be reduced with manual joint manipulation, also called an adjustment. An adjustment to your big toe can potentially reposition the misaligned joint and make the toe straighter. You can often hear a popping sound with an adjustment, which is normal. Although a single adjustment can sometimes completely realign a mild bunion, more than likely it will take several adjustments to treat most advanced bunions. Although a toe adjustment doesn't always reduce the crookedness of a bunion, it can significantly reduce the pain and stiffness of a bunion, making the big toe more functional again. See a podiatrist. Podiatrists are foot specialists who can examine your toes and tell you whether you have a bunion or if you're at risk of developing one. Podiatrists usually treat bunions naturally, without drugs, injections or surgery, with splints, special taping techniques and/or custom-made orthotics, shoe inserts. Custom orthotics and orthopedic shoes are beneficial because they support your arches, provide shock absorption, improve foot biomechanics and reduce the pressure on your big toes. Custom-made orthotics can be expensive without medical coverage, so check your policy, but cheaper off-the-shelf insoles may be beneficial also. You may have to buy shoes a little bigger than you normally would in order to accommodate the custom-made orthotic insoles. Some medical doctors, chiropractors and physical therapists also make orthotics, so shop around for the best price and service. Get a foot massage. Make an appointment with a qualified massage therapist and get a deep tissue foot massage that includes the toes and Achilles tendons. Massage reduces muscle tension, increases joint mobility and promotes better blood flow. 13. Have the therapist start rubbing from the toes and work towards the calf muscles so you help the venous blood and any inflammation return back into circulation. Allow the therapist to go as deep as you can tolerate, especially around the base of the big toe, without wincing. Massage can't treat the symptoms of bunions, but is unlikely to reverse the deformity of them. Start by experimenting with 3 30-minute foot massages spread out over the course of a week and see how it impacts your bunion symptoms. Always drink lots of water following a massage in order to flush out inflammatory byproducts from your body. Failure to do so might cause a headache or mild nausea. Consider acupuncture treatments. Acupuncture is an ancient healing technique, art that was developed primarily in China. It involves placing small needles into specific energy points within the skin in efforts to reduce pain and swelling and stimulate healing. 14. Acupuncture treatment for bunions is not a commonly recommended treatment by mainstream medical professionals, although some anecdotal reports suggest it can be helpful for joint pain. As such, if you've tried other natural treatments without success, then acupuncture is worth experimenting with due to its great safety record and relative affordability. 15. Acupuncture is now practiced by many mainstream health professionals, such as physicians, chiropractors, naturopaths and massage therapists. Regardless, whoever you pick should be certified by the National Certification Commission for Acupuncture and Oriental Medicine. 16. Acupuncture points that may provide relief for your bunions are not all located near the big toe where the pain is coming from. Some points can be in distant areas of the body. Japanese acupuncturists view bunions as a sequel of diabetes, or as a symptom of sugar imbalance in the body. They believe that excess sugar intake results in inflammation, which can promote bunions.